Question number 1. Which of the following conditions is a common cause of prerenal acute renal failure? Option A. Glycosuria. Option B. Myoglobinuria. Option C. Enlarged prostate. Option D. Arthrosclerosis. Answer. Option A. Glycosuria. Rational. Prerenal causes of renal failure are those that interfere with the renal perfusion. Severe untreated glycosuria leading to osmotic diuresis may severely deplete circulatory volume, resulting in acute renal failure. Myoglobinuria and arthrosclerosis are the renal causes of acute renal failure. Enlarged prostate is the example of post-renal cause of renal failure. Question number 2. Most important nursing intervention for a patient with acute renal failure in the diuretic phase involves option A. Providing high calorie diet, option B. Restricting fluid and salt intake, option C. Encouraging socialization, option D. Encouraging deep breathing. Answer. Option A. Providing high calorie diet. Rational. Patient with renal failure must be provided with adequate energy from carbohydrate and fat sources to prevent ketosis from endogenous fat breakdown and gluconeogenesis from muscle protein breakdown. Fluid and electrolytes should be provided adequately to prevent dehydration, hyponatremia and hypokalemia in diuretic phase. Infections must be avoided by protecting the patient from other individuals with infections and restricting visitors. Deep breathing has no special indication in acute renal failure. Question number 3. In oligoric phase of acute renal failure, the amount of urine output will be option A. No urine output, option B. Urine output of 50 to 100 ml per day, option C. Urine output is less than 400 ml per day, option D. Urine output of 600 to 700 ml per day. Answer. Option C. Urine output is less than 400 ml per day. Rational. Oliguria, that is less than 400 ml of urine in 24 hours, is the primary manifestation of acute renal failure. In an elderly patient with oliguric renal failure, urine output may be 600 to 700 ml per day. As the sagging kidney normally loses its concentrating ability, urine output of less than 100 ml per 24 hours is called anuria. Question number 4. A patient in acute renal failure has been prescribed 50% glucose solution with 10 units of regular insulin and sodium bicarbonate. The nurse understands that this therapy is intended to treat option A. Hypokalemia, option B. Hyperkalemia, option C. Hyponatremia, option D. Hypernatremia. Answer. Option B. Hyperkalemia. Rational. Emergency pharmacologic management of hyperkalemia is done by administering hypertonic glucose solution along with insulin. IV administration of regular insulin with hypertonic glucose solution causes temporary shift of potassium ion into the cells and reduces its concentration in the extracellular fluid. Sodium bicarbonate alkalize the plasma and cause temporary shift of potassium into the cells. Hyponatremia and hypokalemia is treated by replacing sodium and potassium. Hypernatremia is treated by infusion of hypertonic saline solution. A patient with chronic renal failure treated with continuous ambulatory peritoneal dialysis develops fever, abdominal tenderness and nausea. Physician suspects peritonitis and sends peritoneal fluid for examination of white blood cell count. The diagnosis of peritonitis will be confirmed when option A, white blood cells count exceeds 100 cubic millimeter and neutrophil count is more than 50%. Option B, white blood cells count exceeds 80 cubic millimeter and neutrophil count is more than 45%. And option C, white blood cells count exceeds 60 cubic millimeter and neutrophil count is more than 40%. Option D, white blood cells count exceed 50 cubic millimeter and neutrophil count is more than 30%. Answer option A, white blood cells count exceed 100 cubic millimeter and neutrophil count is more than 50%. Rational. Peritonitis is a common complication of peritoneal dialysis. Symptoms include fever, rebound tenderness, nausea, malaise, and cloudy dialysate output. The diagnosis of peritonitis is confirmed when white blood cells count is above 100 cubic millimeter and neutrophil count is more than 50% in the peritoneal effluent.